Welcome back to Chambers of Knowledge, where I help you improve your medical literacy so you can understand and effectively communicate with your healthcare team. The purpose of today's video is to explain platelet aggregation. So do you know what happens when you get a cut or become injured? Well, the body pools its resources to prevent blood loss. Hemostasis refers to the success of the prevention of blood loss. Now, the process that leads to hemostasis is known as platelet aggregation. And as the name suggests, this process relies heavily on platelets or thrombocytes. So what is a platelet? Well, a platelet is one of the cellular components of blood that I spoke about in my video titled The Anatomy of Blood. During this process, platelets rush to the walls of damaged blood vessels and clump to stop the flow of blood. So now that I have explained a little bit about the role that platelets play in clotting or platelet aggregation, I'm going to explain the entire process and the structures and components that are involved. So after receiving an injury, whether it is bruising or scraping the skin, the blood vessels of the area will constrict. This is known as vasoconstriction. Now, the combining form vaso refers to blood vessels, while the other combining form constricto refers to narrowing. So after vasoconstriction takes place, the thrombocytes will rush to the site and attach to the injured blood vessels, and they will form clots. This is what will decrease the flow of blood outside of the vessel. By this point, the thrombocytes have released several clotting factors, while the damaged vessels as well as the liver have released other clotting factors. So clotting factors are one of the formed elements of plasma. There are 12 clotting factors, but the numbering is a bit off. That is because clotting factor number 6 has been found to be a part of another clotting factor, so we no longer mention it. Feel free to screenshot for future reference. So the clotting factors create fibrin strands. These are designed to trap the red blood cells and form the clots. A blood clot is also known as a thrombus, hence why thrombocytes have their name. So at the end of this process, heparin is released from basophils. Basophils are one of the 5 types of white blood cells. They release the chemical component heparin to prevent the clot from becoming too large. So if you are interested in content that will and can improve your health literacy so you can effectively communicate with your healthcare team or the healthcare team of a loved one, you have found the perfect resource. I post every Wednesday at 6, so don't forget to subscribe and like, and I will see you in the next one.